Again, ladies and gentlemen, thank you for joining us with our speaker series. We are thrilled to be joined by Claudia Reed, who has been serving as our field placement student as part of her master's degree. She has been working over the last, since January, a project where she's been researching the accessibility of healthcare for individuals with FASD in rural Eastern Ontario. But before we begin, we want to make sure that we acknowledge that we are on the traditional and unceded territories of the Algonquin and Anishinaabe people, where we come together as both non-Indigenous and Indigenous people with the purpose of creating reconciliation. And with that, I turn it over to you, Claudia.
All right. Thanks, Rob. So as Rob said, I've been conducting this research project, sort of trying to assess the accessibility of healthcare settings for individuals with FASD, particularly in like your area, so rural Eastern Ontario. So as Rob said, I am in the process of kind of tying up all the loose ends, getting the report written and edited. So really what I'm hoping to get from this presentation today is I'm going to go through sort of the background, why we're doing the research, what came of the research, and all of the wonderful things that I learned from everybody that I interviewed. And then I'm really just hoping to open the floor for a little bit of dialogue, some feedback, any questions, because I think it's important that I ensure that I'm interpreting the data that I gathered properly, and that I'm not missing anything, and that, you know, if anybody who didn't participate in an interview has any, you know, sort of additional recommendations they want to bring forward, or any more input that would be valuable to the final report. So I'm just going to go through the slideshow, go over sort of what I learned, what the data is telling me, what the recommendations that people shared are. And then at the end, I'll stop sharing my screen so I can see everybody. And then hopefully, if there's any input or any feedback from you guys, I'll write it all down and I'll make sure that it's considered when doing the final report. So the title, Accessibility of Healthcare for Individuals with FASD in Rural Eastern Ontario. So some of you and chatted with some of you, but for those who don't know me, my name is Claudia. I just completed my first year of my Master's of Social Work degree at Carleton University. So I did my field placement with the Rural FASD Support Network. And Rob and Judith were incredibly wonderful in allowing me to explore my interests, social determinants of health, health equity, particularly for marginalized communities, and, you know, my real interest in pursuing public health policy and research. So we were able to come together and sort of look at how my interests could intersect with the needs of people with FASD in rural Eastern Ontario. And we came up with this. So I completed my undergraduate degree in sociology and childhood and social institutions, spent most of my time in my undergrad working in the developmental services, so people with dual diagnosis, intellectual disabilities, personality disorders, mental health struggles, mainly in group home settings and in community. I then transitioned into sort of the addictions and mental health field, doing street outreach for people experiencing homelessness, people with you know, very serious addictions, people living in very serious poverty, and really just started to see the inequity in health and how people, you know, who aren't able to advocate for themselves or aren't heard by healthcare professionals, how they really do fall through the cracks. And I think that that really rings true for people with FASD as well, as we'll see throughout the course of the presentation. So the research project itself was based on the AODA, so the Accessibility for Ontarians with Disabilities Act. So this act mandates how places should be removing barriers and providing accommodations for people with disabilities, and to ensure that their individualized needs are met, recognizing that they may not fall within the general normative depiction of what people need in society. So the AODA has 5 standards. The information and communication standard, so the way that information is shared and communicated to people, whether that be, having Braille signs for people with visual impairments, having written documentation or support with people who have auditory impairments. The transportation standards, so ensuring that everybody has access to accessible transportation, sort of no matter what. The design of public spaces, so this one sort of places a lot of emphasis on physical disability and the need for wide doorways and automatic doors and ramps and those types of things. And then the other 2, the customer service standards and the employment standards. We didn't focus on those 2 for the purpose of this presentation. So we hoped to conduct, and we did conduct, a community-based research project in hopes that we can inform the development of the 6th AODA standard, which is the healthcare standard. So the Government of Ontario is currently working on establishing an accessibility standard for healthcare settings in particular. So when we talk about healthcare settings, we're talking about our physical health, our mental health, our emotional health, our oral health, our vision health, our hearing health, all of those kind of things fall within that umbrella. So the hope is that we can, provide this report to whomever the powers that be, and have them have a very informed report outlining what the specific needs of people with FASD are in healthcare settings from the people who have the experience with FASD. And I think that's sort of the biggest thing here is when I started this research, I knew a little bit about FASD. I reviewed the literature extensively, tried to really inform myself, but most of what I learned came from you guys and doing the interviews and really hearing your firsthand stories. And so for the purpose of this study, we explored the first 3 standards of the AODA. So the information and communication standard. So looking at how effectively healthcare providers, again, mental health, physical health, oral health, emotional health, how those providers are sharing the information and communicating the information directly with the client or the patient. Transportation, so really exploring being in a rural setting, is there ineffective and reliable transportation available for people to get to their healthcare appointments? And then lastly, the way that healthcare settings are designed. So we really wanted to explore, are the way that these places set up really accessible for people with FASD? And following up with recommendations from you guys about what could make these settings better. So just a little bit of background. So recognizing that, people with FASD have unique strengths, they have unique needs and challenges, and, these different characteristics can create barriers to accessing healthcare and healthcare retention. And recognizing that people with FASD have varying characteristics, and there isn't sort of a one-size-fits-all depiction of what people with FASD experience. They have diverse social settings that they grow up in, different families, different environments. They all kind of contribute to different outcomes across the population. So knowing that, one's physical health and mental health are very imperative in sort of mitigating some of the secondary conditions that people with FASD experience. So the research, the background research and the data, informed me that people with FASD are, at an increased risk of substance use, involvement in the criminal justice system, increased risk of poverty and unemployment, just because of, the societal barriers that exist that, don't really meet the needs of folks with FASD. So what we're really trying to do is recognize that by having accessible healthcare, mental health, physical health, emotional health care, we can help to sort of mitigate some of these secondary conditions for people with FASD. And knowing that without the appropriate healthcare and accessible healthcare, they're at a greater risk for these negative social and health outcomes. So what I did all this background research. We went through the whole process of getting an ethics review and, you know, the back and forth of that. So once all those loose ends were tied up, I conducted 15 interviews. So I interviewed 5 individuals with FASD. I interviewed 6 caregivers and 4 healthcare providers. So the intention with the healthcare providers was to include the voices of a diverse sort of pool of healthcare providers. You know, I wanted to talk to people who provide physical health care, mental health care, emotional health care. What ended up happening was the majority of the healthcare providers that I spoke to were those who sort of emphasize the mental health and emotional health care piece, which didn't come as much of a surprise to me, just based on the information that I gained from the interviews. So each person, so when I'm going through things and you're hearing things about the healthcare provider input, just keep in mind that this input was predominantly from those providers of mental and emotional health care. So I asked each person who participated in an interview 5 questions. The questions were the same for each subgroup of people. So the individuals with FASD, the caregivers, and the healthcare providers. They were just worded a little bit differently to take into consideration the different needs and then sort of the different perspectives that people will be bringing. So then what I did was I went over the interviews with a fine-tooth comb. I think I listened and read each transcript and interview 4 times, just making sure I didn't miss anything. And then I kept track of themes. So I looked for things that were sort of being repeated throughout the course of all of the interviews. So it's called a thematic analysis. So I went through and I uncovered all the themes, and that's sort of what we're gonna look at today. So the results. So I broke it down by the themes, initially by the themes that I found within each subgroup. So in terms of transportation, and under the subgroup of individuals with FASD, it was reported that almost all individuals depend on their caregivers for transportation to and from their health-related appointments. And none of the individuals that I interviewed were able to identify any barrier-free transportation services to access their appointments without their caregivers or their own vehicle. And lastly, all individuals with FASD sort of expressed that they have a lot of frustration about the distances, the travel time, and how far they have to go to attend their healthcare appointments. So the feedback from caregivers, similar. All caregivers identified that they acted as the common provider of transportation to and from appointments. Some of the caregivers were able to identify some community supports that may be available to help, you know, in a pinch. But those supports were reported to, you know, have an additional financial strain, and that those supports that are available are not FASD informed. So I think it's noteworthy that we know that folks with FASD sometimes have a lot of, you know, maybe negative experiences, or even just the general anxiety around going to a healthcare appointment, and recognizing that receiving transportation support from somebody who's not FASD informed may not be the most effective way. And then there was limited knowledge of the available, affordable, and reliable transportation supports. So some people touched on, you know, paratransit, you know, taxis and that type of thing, but we're really able to identify some of the barriers to those things, scheduling, even just getting to a stop where paratransit will pick you up. And then really that lack of FASD informed community. So taxi drivers, community drivers, and that type of thing, they don't have the FASD informed lens to provide the necessary support if they were to be supporting someone to an appointment. And then in terms of healthcare providers, so most of the healthcare providers interviewed stated that they would be able to provide a taxi upon request for someone who wasn't able to make it to an appointment. And some of them said that they would travel to clients for appointments when that was an option, or offer appointments through a virtual platform when it was appropriate. So the implications of this. So when I think the biggest, the biggest implication I think seeing throughout the research is really that transitional age. So, the children with FASD and the adolescents with FASD depend solely on their caregivers for that support. And then when they move towards more independent living, especially in rural settings, their ability to have consistent retention in their healthcare will be limited by transportation barriers. And then there's the individuals with FASD who have limited caregiver support. So those folks who don't have that full-time caregiver or that full-time support, they face challenges with scheduling appointments, booking appointments, navigating and affording contemporary community transportation. And then the caregivers are faced with increased financial burden. So both with the cost of transportation, and then a lot of you identified that you have to take full days off work in order to, make the journeys to CHIO and make the journeys to Kingston to get to the appointments. So the additional financial burden on the caregivers was really something that was a thread that came through. So some of the recommendations in terms of transportation that you guys brought forward were an FASD informed volunteer driving service. So having somebody in the community that has a knowledge and understanding of FASD and the unique needs of the community. Mostly everybody were quite satisfied with attending appointments virtually when that was an option. So recognizing that not all appointments can be attended virtually, but when that's an option, it really seems to be something that, offers the opportunity for people to be successful in attending their appointments. Another thing was kind of talking about how jumping from place to place and going to multiple appointments in multiple different locations is really stressful, and trying to understand a way that, those appointments can maybe be lumped together, or, healthcare providers can communicate with each other so that you're not left hopping from hospital to clinic to here to there to try and get all of the healthcare and mental health care needs met. A recommendation from one of the service providers was to encourage, was that service providers should be encouraged to ask the questions. So when somebody, comes in, regardless of who it is, they should be asking if they have transportation, do they need accommodations? And I pulled this quote that one of the service providers had said, if service providers ask the question, then that would help remove the barrier. And I really did hear that, right? I really did hear that, especially from caregivers, that nobody offers, and nobody asks if you need the help. So having service providers ask those questions might be beneficial. And then there were some sort of grandiose ideas, a mobile health service. So, having somebody who can come to your home and provide that necessary healthcare for appointments that, a hospital is not required. Additional financial support for individuals with FASD to support with the cost of transportation. So I know that there are some funds through ODSP, there are some funds through the DSO, but there are a lot of barriers to accessing those funds as well. So recognizing that additional financial support is needed. And then in terms of the healthcare providers' recommendations is that, caregivers and people with FASD should try to advocate for transportation support from their service providers. However, recognizing that it's not just the transportation piece, and that caregiver support is needed throughout the entire process of the appointment would need to be considered as well. In terms of information and communication, so I think that this was one of the big ones. So acknowledging that people with FASD have receptive and expressive language challenges, challenges with memory, and finding a way that we can ensure that healthcare providers, based on the patient bill of rights, are supposed to be giving information to directly to their clients or their patients in a way that they can understand. So some of the themes that emerged from this. So individuals with FASD, so everybody that I spoke to had difficulty understanding the language and remembering information being shared at healthcare appointments. Most of the individuals with FASD reported that they depend on their caregivers or other forms of support for the translation and recollection of health-related information. And individuals with FASD often express that they have difficulty remembering their appointments, scheduling their appointments, which really has implications for that retention piece in healthcare. In terms of the caregivers, so all caregivers identified being responsible for being that sort of gap filler in terms of the information and communication. So caregivers are responsible for hearing the information being given by the healthcare providers, you know, and then going home and working to sort of decode that information in a way that, you know, your child or the person for whom you're caring can understand. And I think the big thing is this, that caregivers not only are then expected to sit through the appointments and hear the information and remember the information and write everything down, but they're also there to provide care for the person for whom they're caring. So there's that additional pressure of trying to balance those two things at the same time. And then in terms of healthcare providers, so healthcare providers identified that they generally require requests for accommodation for different forms of communication. So most of the healthcare providers said that if, you know, there is a need identified, then they're able to accommodate that need. But again, that's the responsibility of the client or the patient or the caregiver to put in that request. And healthcare providers aren't informed enough about FASD to understand that that need is going to exist for most of their patients with FASD. And healthcare providers are willing to provide documents in written format for individuals. However, we also know that some of the healthcare related language and jargon may not be easy for anybody really to understand unless you're a medical professional. So some of the implications of this lack of information and communication sharing, basically individuals with FASD are not being effectively informed about their healthcare by their service providers. And again, we'll go back to the Patient Bill of Rights in terms of that. Healthcare providers and doctors and mental health care providers are supposed to be sharing the information directly with their patients and their clients. Caregivers are responsible for supporting individuals with scheduling, booking, appointment reminders, and everything that goes on in between. They're being held responsible for providing support to those for whom they're caring while simultaneously keeping notes and retaining the information. And then they're also responsible for translating the information. So basically what's happening is the caregivers are taking on the role that the healthcare providers are supposed to be providing. And the biggest implication here is that individuals with FASD who don't have regular caregiver support or those who are transitioning into adulthood will have difficulty retaining the information about their health, and that will place them at a much greater risk of negative social and health outcomes. So some of the recommendations around this, service providers should be accommodating the information and communication needs in a client-centered way. So for example, some of the things that you guys shared were, you know, really focusing on that plain language, expressing things in a way that are easy for anybody to understand, using photos, videos, allowing for audio recording during appointments so that the patient or the client can go home and listen to it again. And then allowing for an advocate to be present as well. So I heard a lot of people sort of express when their kids are reaching a certain age, doctors are requesting that the caregivers leave the room for certain appointments, and that, you know, following that, they're not really, the children or the adolescents are not really able to then share that information with their caregivers, whether they want to or not. They have difficulty remembering the things that were talked about in the appointments. Another recommendation, so in terms of scheduling appointment reminders and those types of things for people who don't have that that really present caregiver support, is that service providers should be helping clients. They should be asking those questions. We live in an age of technology, and it's probably pretty easy for a doctor or even a administrative receptionist at the front desk to help somebody with that need, to put a schedule reminder in their phone, offer an appointment reminder in a way that works for the individual. So asking the individual, can I text you? Can I call you? Can I send you an email? How many appointment reminders do you need? And that type of thing, to really ensure that people are retaining their health care. The biggest one, and this isn't going to be a surprise, is having FASD informed hospital staff. So a lot of people identified that trying to navigate being both the caregiver for the individual with FASD and the information gatherer places a lot of stress, and things get missed, and it's really hard to focus on both of those things at the same time. So somebody present who can fill that gap. So a lot of you said a note taker, or even just someone who is FASD informed, who can go in before the appointment and say to the doctor, look, this is the situation. This is what I know about FASD. This is how you're going to have to approach this situation. And then someone who can offer that support with the system navigation. So, if someone is trying to get their healthcare taken care of and they're being met with barrier after barrier after barrier, having that FASD informed hospital staff who can help to sort of navigate those systems and connect somebody with the appropriate resources. And a recommendation from the healthcare providers would be to empower clients and caregivers to ask for additional support when you're scheduling your appointments, so that service providers have that opportunity to make those arrangements when it's possible. Recognizing that we know there's a lack of FASD informed care providers out there, but maybe sometimes just asking the question before the appointment, saying, hey, we may need some accommodations. Is there someone who can sit in and take notes? That type of thing is what the healthcare providers suggested folks be asking for before their appointments. And then the last one, design of public spaces. So the reason that we really wanted to look at this one is because a lot of the emphasis, again, is on the physical sort of disabilities, and we're not looking at the emotional and the mental health piece that exists for people with FASD in contemporary spaces. So the individuals with FASD, everybody reported crowded weight rooms, loud offices, those types of things. They generate increased anxiety levels and overstimulation. A lot of folks talked about previous trauma and stigma that they've experienced in healthcare settings, and the discomfort that comes with that when you have to go back and attend an appointment in that setting. And then the overarching frustration with multiple appointments and multiple locations, and just this desire to have everything in one spot so that it can make, getting used to that space and getting comfortable in that space a lot easier. Caregivers, so healthcare settings often don't offer a welcoming environment that support individuals with FASD to have a positive experience. So looking at the time, like spending, an hour in a weight room, a busy weight room, not quiet weight room, generates increased anxiety levels, both for individuals with FASD and their caregivers. So a lot of caregivers reported, the feelings of stigma that they experience in, when they're sitting in weight rooms and, their child is overstimulated, and the stigma that's, coming onto them from other people in the weight room. And then a lot of talk about the privacy. So talking about how, in order to effectively engage somebody with FASD in their healthcare, the way that these spaces are set up with, loud hallways and you can hear through the walls, and those types of things really don't allow folks with FASD to be present in those appointments, because they're too overstimulated by all of the other things that are going on around them. So lastly, healthcare providers. So most people said that accommodations can be provided upon request for a quiet space away from crowded weight rooms. So the implications of this. So many of the individuals with FASD reported they'd rather miss their appointment than experience the difficulty associated with the loud, busy, long wait times. So they'd rather just not go and kind of deal with the repercussions of that. And you know, the implications of that are those secondary conditions that can arise for folks with FASD. Yes, caregivers experience stigma from others in the waiting areas due to increased stimulation and anxiety of the individual for whom they're supporting. And without the appropriate privacy, individuals with FASD are just not going to be informed about their health-related information without that caregiver support. So some really cool recommendations came out of this, and I think some really realistic recommendations came out of this. I think the biggest one is this notification service. So, you know, we go to a fast food restaurant like McDonald's, and they have all the order numbers up on the screen, and you can kind of see the sequence and, you know, how much longer it's going to be until your order's ready, and kind of the idea of offering something like that in a hospital. So if you go and you check in for your appointment, and then they text you when you know you need to be back in 5 minutes, so that you can just sort of go wander, grab a coffee, go sit in the car, go sit somewhere more quiet, right? So something like that is, I think, quite realistic, and could really help sort of mitigate some of those negative effects of those wait times and those wait rooms and those busy environments. Secondly, again, very realistic, providing a separate quiet waiting space for individuals who have difficulty with regulating their emotions in those overstimulating environments. So, you know, having a separate space with, you know, fidget toys or calming music or, you know, activities, something that where they can wait and not then go into their appointment with those increased anxiety levels. And then, yeah, more friendly options while waiting. So having something on the television, fidget toys, you know, plants, soothing music, and those types of things to just really create a more calming, soothing, less industrial, less clinical environment that could support in mitigating some of that anxiety. And then I kind of brought everybody together, and I wanted to look for themes that I saw weaving through all of the subgroups. So really what presented was the siloed services. So the lack of consistency and collaboration between service providers, the need to like recount the same information each place that you go, the traveling to and from different institutions and different clinics and different service providers, and really just this desire to have everything in one place, you know, have somewhere that you go, you know. I heard good things and I heard not so good things about CHEO, but if you could just go to CHEO, right, and just have your appointments at CHEO and have all of your needs met there, then maybe someone, you know, can get comfortable in that environment, knowing that that's where they're going, they know what to expect, that kind of thing. The biggest one, and I think everybody sort of knows this, is the lack of FASD informed supports. So everybody through every interview, you know, stated that people don't know enough about FASD. And this quote, you can't accommodate something that you don't understand. So, you know, we have an expectation that these accommodations are going to be provided for people with FASD. And we recognize that it is the lack of knowledge that is the biggest barrier within these settings, because if people understood FASD, then they would know the accommodations that would be necessary, or they would know to ask the questions. So you can't accommodate something that you don't understand, I think is really meaningful. So really looking at how we can get the greater community more FASD informed. And then this one, a lack of mental health support, particularly for transitional aged youth. So really hearing that transition from the child mental health care system to the adult mental health care system is a huge barrier. There's gaps in service for certain age groups, and you know, people who have been seeing the same mental health care provider for a number of years are then expected to, you know, go to see someone completely new and recount all of their stuff again. And you know, so really that the lack of mental health support and that transitional age is a really big one. Recognizing that folks who are, you know, moving towards independence, we need to know that they are going to have the necessary supports in place from their healthcare providers. Busy lab waiting areas are a large barrier to success at appointments and retention. So all participants, even the healthcare providers, acknowledge that wait times, difficulty with scheduling, those types of things are particularly challenging for people with FASD. And I did see, on a positive note, that the mental and emotional health supports tend to offer more client-centered accommodations when they're requested. So maybe not so much in the physical health realm or, you know, the dental health, those types of things, but within the mental and emotional health support, I found that those who knew what to ask for were generally able to get those accommodation needs met. But without the resources available, without the additional staffing, without the additional space, and without those FASD informed staff, those accommodations are just going to remain limited and not as easy to access. So the implications for these, the siloed services, they generate a lot of stress, anxiety, potential for re-traumatization when individuals are required to recount stories. Without FASD-informed healthcare providers, caregivers will continue to hold the responsibility of providing that health-related information that is the responsibility of the healthcare provider and not the caregiver. A lack of mental health support for transitional aged youth increases the likelihood of individuals with FASD experiencing those secondary symptoms. So knowing that people who are transitioning from the child mental health care system to the adult mental health care system, if they fall through those cracks, the likelihood of those secondary conditions like substance use, involvement in the criminal justice system, those risks are greater. And just generally, like a lack of these accommodations will and can result in a lack of retention in the healthcare. So recommendations around this. Recognition of the need for consistency. So healthcare providers should attempt to meet individual needs when that's an option. When making referrals, healthcare providers should provide new service providers with the health information. Those charts should be shared so that people aren't expected to recount the same things over and over again, especially when they're traumatic experiences. Those things can be really difficult. To begin the referral process to transition to adult FASD-informed mental health supports before aging out of the system. So like a recognition that process should probably be started sooner than it's being started. So when somebody's 17 and a half and then, you know, the mental health care providers are scrambling to get them connected to those adult services, a slower transition from the child to the adult mental health support system, I think, was shared that would be more effective. Healthcare providers to be informed and integrate services that support FASD-informed system navigation. So we know, you guys know, the resources that are out there. You know, I heard so many wonderful things about places like Kids Inclusive, the Rural FASD Support Network, Open Doors. So really tapping into those supports to fill those gaps. And again, the caregivers are responsible for that. And a lot of the onus needs to be placed on those healthcare providers to be getting connected and making themselves aware of those supports that exist. And lastly, mandatory FASD education and training for all individuals providing supports and services in the community. So, you know, I heard a lot of the healthcare providers say, oh, you know, I did a half-hour training session on, you know, FASD basics. So like, I'm good. But I'm sure all of you guys can attest to the fact that you can't learn what you need to know about FASD in a 30-minute sort of online crash course. So really recognizing the prevalence of FASD in the community, the underdiagnosis of people with FASD. So a lot of folks fall through that diagnosis crack, and so recognizing how prevalent this is in our community, and how important it is to have those FASD-informed supports in place. This quote kind of stuck out to me. A lot of agencies will use the phrase, "we can't put in more effort than the client." And with a lot of individuals who are at a transitional age in particular, service providers need to understand that it's unlikely that a child will ever put in as much effort as the provider. So as service providers, we need to put in more of the effort. And it was nice for me to hear this coming from a service provider, right? That recognition that there is still this idea that, you know, we're only going to do as much as the patient or the client, and service providers need to understand that that's not a realistic expectation, particularly for people with FASD. So service providers really do. They need to put in more of that effort to ensure that they're informed and to ensure that their individual patient and client needs are being addressed. So some conclusions. Again, given the prevalence of FASD in the community, healthcare providers should be more FASD informed, and mandatory FASD training and screening should be conducted for new patients. So I heard a lot of people say, you know, you fill out these questionnaires and they ask you, do you have anxiety? Do you have, you know, mental health struggles? Do you have a history of high blood pressure? All of those things. And it would be simple to just put a piece on there that, you know, do you have any diagnoses that, you know, would be helpful for us to understand when providing your care? So ensuring that healthcare providers and services are really asking that question, given the prevalence of FASD in the community. And FASD is not as well recognized as other neurodevelopmental disabilities. So we hear a lot of talk, you know, about Down syndrome, autism, and we're really placing a lot of emphasis on the community, in the community, to provide those supports and that understanding and reduce that stigma around those diagnoses. But FASD is still incredibly stigmatized. So without that recognition, it's going to be very difficult to remove that stigma and the barriers. Transportation barriers can pose challenges for individuals without caregiver support, and even with caregiver support, the added cost, the time off work, all of those things create immense barriers for people to retain their health care. Information and communication needs to be shared with clients and patients in an individualized way that considers their unique strengths. So again, really having service providers ask those questions. What's the best way to communicate this information with you? How can we help you to get that information, to take some of that burden off the caregivers so that they can do that, provide that care and support the children through those appointments, and help, you know, mitigate some of the anxiety and not be held so responsible for taking in all the information along with that. Accommodations are needed for quiet and soothing spaces. Anybody, not even just people with FASD, but anybody who experiences, you know, any sort of social anxiety, overstimulation, and that type of thing, they should have that accommodation available to them so that they can be successful. Caregivers and individuals with FASD have the right to demand accommodation that meets their needs. So everybody has the right to ask for that additional support, and everybody has the right to be given that additional support if it's requested. And then lastly, like, there are some supports out there, but they're really only provided, again, upon request, and then when those resources are available. So looking at, you know, short staffing and all of those things. Yeah, so where do we go from here? So what I'm hoping today is that we can chat, you know, maybe 20 minutes or so about what you guys think of all of this. I really want your feedback. I want to incorporate as much feedback into the final report as possible. You guys are the experts. I'm just here learning from you. So I want to make sure that things are being depicted in a way that is accurate. So yeah, I want to know, have I collected and analyzed the data in a way that effectively depicts your experience? Did I miss anything that should be added? Is there anything else I should consider? Are there any other recommendations that folks can make? You know, analyzing the implications of this data with regards to the AODA and the Patient Bill of Rights. So looking at this data and saying, these are people's rights. This is the legislation that exists, right? These are the pieces of legislation that exist to protect people in our community. So looking at what I'm learning and what I'm hearing means that there's more work that needs to be done for healthcare providers to be sort of upholding their end of the deal here in terms of the AODA and the Patient Bill of Rights. So I am in the process of revising and editing the final report, and I would really like to include additional feedback if there is any. And then after the report is written, it's going to be disseminated. Rob is kind of the mastermind behind where all that's going. But I'm thinking it's going to be sent locally, it's going to be sent provincially, and hopefully federally as well, so that when we're considering, when you know, these governing bodies are considering the needs of people with FASD, that this is being sent to those people that are creating this healthcare standard. And yeah, we hope that this data will be used to inform the development of the healthcare accessibility standard, so that all of your voices, you know, the people who are impacted by FASD, are considered, because you can really only learn so much from research. And like I said, I learned way more from these interviews than I ever did reading, you know, from data sources and stuff. So this is hopefully a way to get your voices heard, and have your recommendations taken into consideration. So now I just want to open the floor for any questions you might have, any feedback you might have, anything else you can recommend that could be included in this.